I now recognize Ms. Ross from North Carolina for 5 minutes of questions.
Thank you very much, Mr. Chairman. Just this morning, the Select Subcommittee Democrats released a report to correct, on the record, the allegations that Dr. Fauci and Dr. Collins had involvement in the proximal origin paper. And I'd like to revisit some of the questions that Mr. Raskin asked about who organized and facilitated that paper. And I want to be clear that I'm not suggesting that there's anything untoward or nefarious about the paper or the events leading to its publications. But my colleagues on the other side of the aisle have made allegations today, unsupported allegations, that I believe misrepresent who did what for the paper and why. From what I understand, again, this all started on February 1st, 2020, in a conference call where some virologists and scientists, including those from outside of the United States, got together to discuss a novel coronavirus and make an analysis of its genomic features. Dr. Anderson, is it accurate to say that because this was not their area of expertise, Dr. Fauci and Dr. Collins attended the call with the goal of hearing what you and other experts, including your eventual co-authors, thought of the virus's genomic features?
That is correct.
And in the period following the call, you and your co-authors began to work on what would become the proximal origin paper. Is that correct?
That is correct.
The Select Subcommittee has reviewed thousands of pages of documents and communications between you and your co-authors. In our review, it became abundantly clear that Dr. Fauci and Dr. Collins had little to no involvement in the paper. For example, Dr. Anderson, when asked about Dr. Fauci and Dr. Collins' role in the paper, you told the Select Subcommittee staff, quote, they played no role in the paper. Is that correct?
That is correct. I think it's important to understand that we are talking about an international group of known experts drafting a paper. The whole idea that NIH directors would have a role in that paper is obviously false. So it is true to say that, yes, they played no role in this paper. Of course, they appear to have been interested in the paper because they were interested as non-experts in the conclusions and the research itself.
Thank you. In my remaining time, let me turn to you, Dr. Gary. In the final stages of drafting the paper, you sent an email to your co-authors stating, quote, Jeremy Farrar, you were referencing him, had been an amazing leader. You also told Select Subcommittee staff that Dr. Farrar played a substantive advisory role throughout the drafting of the paper. Is that correct?
That is correct.
And did Dr. Fauci or Dr. Collins ever influence the conclusions drawn in your paper?
Not in any way.
So it seems to me, when we don't have the cameras rolling, even my Republican colleagues might concede that Dr. Fauci and Dr. Collins did not organize or facilitate the proximal origin, and that Dr. Farrar did instead. For example, on March 5th, 2023, Select Subcommittee Republican staff memo stated, and I quote, Dr. Farrar led the drafting process of the proximal origin paper. And the subpoena my Republican colleagues issued as part of this investigation last month acknowledges that Dr. Farrar, quote, organized the February 1st, 2020 conference call that they allege led to the proximal origin paper. These findings underscore the fact that scientific rigor, especially in the face of global health emergencies, requires international cooperation among experts in the field. Epidemiologists, virologists, doctors, and public health experts like Dr. Fauci and Dr. Collins must be included in the discussions concerning how we investigate and respond to pandemics. However, just their cooperation and inclusion is not evidence of collusion or secrecy. It's simply the way the scientific process works. This kind of coordination enables us to have accurate information, strong lines of communication, and ultimately helps us save the most lives. Thank you, Mr. Chairman, and I yield back.
I now recognize Dr.